Hey, welcome. I'm Dr. Gilmet. No picture in picture today. We're recording in a different place. But what I wanted to do is I wanted to update a video about the growth in the coronavirus I did a couple of days ago. Why are we locked down? The growth of COVID 19. And so when I was watching the news last night, I saw that the number of cases in the United States had hit 54,000. And when I was originally predicting things, let's see, let me go to the original current growth trend. When I was originally looking at this data for March the 26th, it was looking like maybe 10, 11, 12,000 cases. And even when I went and did my conservative estimate of what I thought might be on the 26th is 21,000. I was like, wow, 50,000, 54,000 is way different. And so what I did was I went back into the spreadsheet, right? And I actually updated it. And so what I have here is fifth or sixth tab, and I looked again at the doubling in the number of days. And so what I did was these didn't change. And then I looked at each of these, and now I actually had data for from 1,000 to 2,000, 2,000 to 4,000, and 4,000 to 8,000. And a lot of what I'm hearing from the infectious diseases experts is that this virus is doubling anywhere from reports are 2 to 3 days, 3 to 4 days. Um, Maybe 5 days. I haven't actually heard anybody say that. I have not heard an expert say 5 days. So I was looking at this and I go, okay, what is this telling me? If I get rid of this early stuff and I just focus on what seems to be the current pattern of every 4 to 5 days, according to the CDC data, what I get is a median of 4 and an average of 4.4. Now remember, the median earlier that I used to predict was just 5, okay? So this is 1 day different. I'm holding my finger up right now, but you can't see me. Now, to get this number, um, obviously a 16% growth rate is probably too slow because I'm not at quadruple the number of cases by 9 days. 17 seemed a little bit too big because by the time we get to 5 cases, so I settled on 16.7. Now, I'm going to say this. I could have mathematically modeled this and figured it out exactly. But seeing as how these are all rough estimates, as you will see, as we are extrapolating out into the future, I felt like this was accurate enough. We're right at about a quadrupling after 9 days. And we are at a little more than 2 at 5 days, which means somewhere between 4 and 5. We doubled again. So this seems like a really good percentage to use, this 16.7%. So again, I have adjusted my model one more time. Now, we're going to scroll down, okay? Now, illnesses after 314 may not be reported yet. This is something that I did not notice earlier. This text box right here says illnesses that began during this time period may not be reported yet from 314 to 324. And right now it's 326, so obviously from 314. So what I did was I actually went ahead and scrolled down to 314 and I said, okay, this is my last set of good data. All right, so just like I did before, I went ahead and took these two numbers and added them together to get my total number of cases. And then I actually doing the growth rate as the 16.7% increase right here. So I'm going, the 14th is the last day for which we probably have good data. So I'm going to start on the 15th with my projections, which is why this is highlighted again. So here are my projections, right? So that means that on the 26th, I actually predicted 52,000 actual cases, right? So if we go and we look at the CDC website, they're at 54,000, okay, actual reported cases. So I'm really inclined with that. This is the part that's freaking me out a little bit. And the COVID 19 live data what we see is that there are actually 68,481 reported cases from what he is collecting from all across the country. So this is more of a live update from different health organizations and stuff, and he's putting this together. Okay, so this actually could be conservative. This 52,000, right in line with the CDC data, could be super conservative. Could be that, that it jumps up in the next couple of days because you can see 60, 70, 80. It's going up by about 10,000 cases a day. So now what does this mean overall, right? So April 1st, okay, just 5 or 6 days from now, it looks like we could be at 131,000 cases. And by the end of the month, if this social distancing is not working, by the end of the month on May the 1st, right, we could have 13.5 million cases with 2 million new cases reported on the 1st. Okay. Now, I just want to remind you that I heard information that we have about 100,000 ICU available beds in the entire country. Um, we're going to have 1 million people a day, up to 2 million people a day, sick, infected. All right. Now, what does this look like? Well, this is the chart that I did. I don't know if I can make this bigger without messing stuff up. Okay, here we go. Here's the chart that I did earlier from the onset of the virus. This yellow curve right here was what I actually conservatively predicted was going to happen with about 3-ish million people, 3 million people infected on May the 1st. This new projection, this blue curve, is now our current track that I am predicting giving the CDC data. You can see there is a huge difference between those two. It's not even close in a couple of weeks. All right. Now, this brings us to 2 points. One is this data is being extrapolated. When you extrapolate data, especially as far as I'm extrapolating data, with the level of uncertainty in the number of cases that we have, this can be really difficult. That 13.5 million could be an overestimate, could be an overestimate, could be an underestimate. We don't actually know how much we're bending the curve right now. But why? Why are these two curves so different right now? I have what I think is a plausible explanation. In the end COVID-19, you can see that New York is showing 33,000 confirmed cases, which is almost half of the confirmed cases in the entire United States. So, what's going on here? Well, I have this news article. It's a couple of days old. The New York expects to soon be conducting 7,000 coronavirus tests per day. I was listening to a podcast last week. It said 5,000 a day. So I have two independent sources to capture a better understanding of the COVID-19. Sorry about that. What began as limited corona testing in late February has steadily ramped up since New York health officials developed the COVID-19 test and gained federal approval on February 29th. So they are testing way more than pretty much anybody else. I suspect that New Jersey, California, Washington, Michigan, Florida, I suspect that all of these places have more cases than are reported now because New York is doing testing at a level that I have not heard that the other states are doing it at. And so, again, my extrapolation is only as good as my data. This 13.4 million, 13.5 million people could be a serious underestimate if we get other states testing at the same rate that New York is testing at. And this is why we are sheltering at home. This is why we are locking things down. We're trying to bend this curve down. Now, in 2 weeks, we may have really seriously slowed the spread of this virus, and this curve may not come to pass. And that would be excellent. That would be great. Remember, statistically, mathematically, we are modeling, we are extrapolating, and we don't actually know what's going to happen. but this is the best information that we have at this point. And so this is why the government is telling us to shelter at home. This helped you understand two things, extrapolation and shelter at home, then I am very happy with this updated video.